Everyone, and welcome to our next teaching session, which is physical disability on unit 20. So if you have your workbooklets handy on page 99, I shall talk you through it. So your learning outcomes for this unit are knowing the importance of a person-centred approach for a person with a physical disability, know the main causes of a physical disability, identify disabling factors, identify the benefits of independence for people with physical disabilities, and give examples of how to promote inclusion. So very similarly to what we've looked at for the past two units there, what we are doing again on this unit is summarising everything that we've covered already, from communication, from the laws that protect people, from the rights that individuals with disabilities have, so that we can focus on sort of how we put that into practice. Okay, so physical disability, what does it mean? So the definition under the Equality Act of 2010 says, you are disabled under the Equality Act of 2010 if you have a physical or mental impairment that has a substantial and long-term effect on your ability to do normal day-to-day activities. So what that's saying is that the person with a physical disability, or the definition of disability, is if you have a physical or mental impairment that has substantial, so a very, very high, and long-term, so a very long negative effect on your ability for those normal day-to-day activities. When we looked at learning disability, it said that normal day-to-day activities were things like household chores, managing your money, socialising, getting out and about, those types of things. So like you can see that there as well. So some facts about physical disabilities. Okay, so there are over 11 million people with a disability in the UK, but less than 8 of those disabilities require the use of a wheelchair. So for some reason, when we think of disability, we think of wheelchair users, and it's not the case. So I think that assumption comes from the signs and symbols that we see, like disabled toilet has a wheelchair on the front of it, doesn't it? Disabled parking has a wheelchair next to it. So I think that sort of feeds our brains with, oh, people that are disabled have a wheelchair. But it is only 8% of that 11 million people. More than 60% of people say that they are avoiding the disabled because they don't know how to behave around them. So this is why it is so key that we cover this unit, isn't it? Almost 2 million people in the UK are blind. So that is a physical disability. Approximately 2 million people in the country use hearing aids. Over 800 babies in the UK are born deaf every year. Most of these babies are born to hearing impairments, so parents that do not need hearing aids, parents that are not born deaf. Up to 6,000 people in the UK have restricted growth. Nearly 1 million people are believed to have a learning disability in England alone. 10% of children aged 15 or younger have a mental disorder. Over 750,000 children in the UK have a disability, and these are most likely to come from low-income households. Up to 1,800 babies in the UK are born with cerebral palsy each year. So I hope you can see the relevance of why we cover this unit in terms of childcare as well. You know, we've talked about babies and children quite a few times there. And these are facts. You know, this is the world, this is the country that we're living in. So when we are viewing that individual with a physical disability, just because somebody has a physical disability, it does not mean that they lose their rights to be individual and unique. So outline why it is important to recognise and value an individual with a physical disability as a person first. So just because somebody has that physical disability, it doesn't mean they lose their rights to be individual and unique, because everybody should have the right to express themselves. If we treat everybody the same, then we're not being fair. So we looked before at equality, and that's where that stems from. So in a nursery, if every child had to ride a bicycle for 10 minutes each break time for exercise, then children with a physical disability could be disadvantaged, or they could hurt themselves. I have got a couple of videos on there on the slides for you, so I would like you to have a look at them if you get a chance before you answer this question. Okay. People enjoy being able to be themselves, but there are some barriers that can stop them from doing that. But despite having those barriers, they want to be able to enjoy and appreciate having choice and being able to access things like they do. This helps their well-being and allows them to have an individual identity rather than just being known as Joe Bloggs who is disabled. Which is where we go back to sort of the bit that we've covered on the previous 2 units, where we are viewing that person as a person before their disability. So we're not saying the white girl, we're not saying the disabled girl, we're not saying the fat girl, the ugly girl, the geeky girl. We are saying their name. That's the best outcome, isn't it? To say, oh, she's called Michaela, not Michaela with a wheelchair, not Michaela with a walking stick, not Michaela with hearing aids. Just my name will be fine. Because people don't need labelling because they've got a disability. Okay. Should help you to answer part A on 101. So I've got an example for you there. So it is really, really important to recognise and value an individual with a physical disability, because it shows that you respect them, and this helps them feel like they are not being labelled negatively or being defined by their disability. Okay, so if you can pause this video now. So we're going to move on to the next section, which says give 4 examples of how to use the person-centred approach when working with individuals with a learning disability. With a physical disability, excuse me. That's because I've just recorded these back to back. So when we're thinking about those person-centred care plans, again, it's a bit repetitive this because it is the same thing, but it's about putting it into practice no matter what the difference is that that person has. So you're going to ask the person you're caring for, what do they want? You're going to give them the choices. You're going to ask their families, how would they like their care delivered? Do they want to be treated differently? Do they want to be treated absolutely no differently? Because people will view their own disabilities different to one another as well, because everybody's unique. The more information that you have about the individual, the more person-centred their plan of care can be. But you also need to make sure that you are using appropriate language and not talking down to somebody. So just because somebody is blind, it doesn't mean that you have to speak to them like they're 3. This is something that I've personally witnessed, and it's horrific. There is absolutely no need for it. That person is absolutely coherent here, just their eyes don't work. So what I would like you to do is to give 4 examples there. So appropriate language could be 1, choices could be another, asking the individual what they want, asking the carers or the families what they want. It could be something as simple as using their name. And all of these things promote privacy, they promote dignity, they help them to gain or remain independent, and it helps people to feel valued. Okay, so pause this video here so you can finish page 101. So the main causes of physical disability. So do you know what can cause a physical disability in a child or in an adult? So there are 3 groups to this. So there are 3 groups of disabilities. So some are congenital, some are acquired, and some are progressive. So what we'd normally do at this point is get you to do a bit of a research task on this so that you can find out all about those different types of disabilities. Okay, so the first group of disabilities we're going to look at, please don't write these in straight away because we're not quite there yet, are congenital disabilities. So a congenital disability means that babies are born with a disability, okay? So it's not happened throughout their life, they've just been born that way. So this could be sensory loss, such as being blind or being deaf. This could be cystic fibrosis, which is a condition that affects the lungs because they fill up with fluid very, very quickly. They have to take lots and lots of medication, and they have to have a physio come round quite often to do like massages, quite harsh massages, to sort of help remove that liquid from the lungs. Spina bifida. So spina bifida is where the spinal cord is exposed, which can cause lower limb paralysis. So it can cause problems with their legs. Cerebral palsy, it can be caused by an underdeveloped brain in the womb, or it can be caused when the brain is damaged during childbirth. Okay, so 4 of those there were sensory loss, cystic fibrosis, spina bifida, and cerebral palsy. So the next section says acquired disabilities. So acquired disabilities, what does this mean? So this means that the disability develops in a person's lifetime as a result of an accident or illness rather than being born disabled. So an acquired disability could be caused by a head trauma, it could be caused by abuse, it could be spinal cord injuries, sensory loss, so such as your vision or your hearing not being as good as it once was. You could lose your limbs. Meningitis is something that could affect anybody in any stage of life, but we do see it in children as well there, where they have to have limbs removed, their legs removed, their arms removed. The last one we're looking at, the third group here, is progressive. So this means that the disability gradually over a person's lifetime. So this could relate to children and adults, okay? So the first one is muscular dystrophy. The second one is multiple sclerosis. The third one is dementia. And the fourth one is when somebody's vision or hearing gets worse over time with age. So what I would like you to do is to give me 3 from each of those sections to fill those circles up, okay? So if you can give me 3 from each of those sections, I shall give you a chance to do that now, so you can pause here. Okay, so your last outcome says you are going to make an information pack on the challenges of living with a physical disability that would suit a new member of staff to gain some knowledge. Okay. So your first question says, identify factors that have a disabling effect on the individual. So things that are in the environment that could have a negative impact on that person with a physical disability. So you can think of it in terms of a school, you can think of it in terms of a nursery. So the first one I've got on my list here, unsuitable transport, okay? So if the transport is unsuitable for this child, if they cannot get into the car, into the van or out of it again, you know, perhaps the ramp is broken to get the wheelchair in ways, you know, the car could be too low or too high. In terms of getting to the school, the access is not there. They can't get there, so they can't learn. Unsuitable transport was that one. The next one says unadapted equipment. So not being able to reach the water or the sand to play, not being able to sit on a regular chair. So some children as well will use a standing frame if they're unable to stand themselves. Perhaps the standing frame would allow them to play with, I don't know, the home corner and play with the kitchen and do some pretend washing up and things. But they're not going to be able to do that unless the equipment is there. Painted edges on steps, okay? This is something that you might not have thought of before, but when you are quite often in public buildings, the edges of steps have sort of the edges of them just painted here, maybe in yellow. And the reason for that is because people with sensory loss, so people with difficulty seeing those stairs, it's much easier if the edges of them are highlighted with a different colour. So if those edges of the steps are not painted, it can be very difficult for someone to see where that step ends and the next one starts. A couple of others there, so ramps, lighting. If the lighting is too low or too bright, it can affect people. A noisy environment, so if the environment is too noisy, it's going to affect their ability to hear or to perhaps communicate themselves as well. So I'd like you to pick 4 of those, so you can write those in now, so you can pause me here. So 71 says, give examples of how to challenge discriminatory attitudes. So some examples of discrimination and attitudes towards discrimination are assumptions and beliefs that aren't very nice. So viewing people as disabled before the person, so she's disabled so she can't do that. You're not letting that person have a voice, you're not letting them have an opinion, you're not letting that person have a chance to prove you otherwise either. Relationships, interesting one. Not allowing teenagers with disabilities the opportunity to explore relationships. Again, it's a little bit tricky because you will have to treat the teenager as an individual, but if it is safe, if they're able to have that relationship, then there shouldn't really be a problem with having to stop it. Another example of relationships is separating children so they don't make friends. So isolating a child, right, you need to come into this room because you are disabled. You can't see if you go in there, so we'll sit in here today, just me and you. You're just making it really difficult for that person to have friendships, and that's not very fair. I think we all know how it feels to be isolated at the moment. I've been on my own all week. I'm feeling it, so I wouldn't like that to happen to my child or myself for sure. Culture. So some culture views disabilities differently and they need caring for when they may be very independent. So in some cultures they see people as very disabled. Oh, no, she can't do that because she was born this way, and so we do everything for her. It's better for her this way because we need to take care of her. So how can we challenge that discrimination? What can we do to make it better for that person? Because we need to make sure they've got rights. So first and foremost, we need to make sure that equal opportunities training is undertaken. By taking equal opportunities training, which they should be doing every year anyway, in a health and social care or education setting, it should keep people sort of on the move. Maybe they need to take that training again if they've not quite hitting the mark in terms of promoting equality. Directly challenging discrimination. So this is a bit of a difficult one. It really depends on the situation that you're in, because it could make things very uncomfortable for yourself in your workplace. So only directly challenge if somebody is perhaps about to be harmed. Empower the individuals who are being discriminated to make change. So when we were talking about person-centred support, I said it can be very, very difficult to go into a new workplace and make changes. but over time you can empower those individuals to give them a voice. Other ways are getting help through charities. So there's lots of charities. I already mentioned MenCap, Scope do lots of help as well. That's a way to challenge discriminatory attitudes. They can help you to do that. And another way, of course, solicitors. In terms of in the workplace, you shouldn't have to do that. But if an individual with a disability that you know of, maybe personally, or maybe it's a colleague, then obviously yes, solicitors can help to fight that as well. So I'd like you to write 4 of those in those boxes for me for 71. So for 72, it says outline the effects that having a physical disability can have on an individual's day-to-day life. So there's lots of barriers that can be in the way of people having a easy accessible life, and it is such a shame. So educational opportunities, so they may not be able to access their education because there might not be a ramp, or there might not be braille for blind people, or there might not be a hearing loop for people with hearing loss. People could also be stereotyped as being a lower ability and put into a different class because of their disability, when in fact they could be very, very intelligent. Think about Stephen Hawkins. He was a very intelligent man, but he was also quite severely disabled. Another way is housing. So housing can affect somebody's day-to-day life with a physical disability. There are not many houses that have been adapted for people with physical disabilities. So you've got to think about it, haven't you? Like, what would a blind person need at home? What would a person in a wheelchair need at home? There are so many adaptations that need to be taken care of that you couldn't have a house that was already catering for everybody's needs, because it would be near impossible. Access to leisure activities. So exercise classes, or perhaps like play gyms and things, may not be suitable for people with a physical disability. Relationships, so they might be viewed as not being able to have a relationship in older life. Healthcare, so that's another barrier because it can stop people from working, it can stop people, children accessing education because they might need various different appointments. Travel. Are aeroplanes accessible? There are lots of YouTube clips with people with physical disabilities showing how inaccessible aeroplanes are. That's certainly worth a watch if you've got a free evening. Employment. So if somebody has a spinal cord injury and they want to work in an office, so perhaps they're only paralysed from the hips down, so they can use their hands, they can type. Okay, who's going to change their bottom? And this is the reality. Although, yes, they want to go out to work, and yes, they are skilled, and yes, they are able to do the job, they can't access employment because they can't have their physical needs met. So when you are writing out 72, you can start it with the effects that having a physical disability can have on an individual's day-to-day life are, and then give me a few examples there. So we talked about education, housing, leisure, relationships, healthcare, travel and employment. So your next question says, give examples of how individuals can be in control of their care needs. Okay, so when we're thinking about how they can be in control of their care needs, they should have a voice, okay? And with their voice, they can be positive, but they can also be negative, because they do have the right to refuse care, okay? It's not automatically consented, okay? So that you have to respect the right that they can refuse care. in control of their care needs is to make sure that they've got all the aids and adaptations that they need in their home, okay? This is going to help them to stay as independent as possible. So I talked a bit before about a standing frame. There could be a walking frame. It could be hearing aids, it could be glasses, it could be large print books. All of these things, these adaptations, can help people to maintain their independence, and in turn with that, they're in control of their care because they're in control of part of their life. Another way is to be involved in that care planning, of course, and having a good relationship with their key worker, okay? There's no point in allocating a key worker to somebody if they don't really see eye to eye, or if they have a lot of differences, perhaps one winds the other up. There's not a lot of point in allocating that person to be someone's key worker if the relationship isn't there. We can't force it. So give those examples of how individuals can be in control of their care needs. So your first one, you could say respecting the right to refuse care, having a key worker who they have a great relationship with, letting them be at the centre of their care plan, and making sure they've got adaptive equipment to help them to maintain independence. Okay, so last page of your booklet. Wow, we've come a long way. So your question says, outline the importance of promoting independence for individuals with a physical disability. Okay. So encouraging independence is going to help somebody to feel valued in life and to feel like they have a purpose in life. You know, any of us could become physically disabled at some point in our lives, and it doesn't mean that we have to lose every sense of who we are, okay? People with a physical disability still need to be valued. They still need to have their own identity. They still need to have their own choices. They need to have the confidence to speak out about their care and to tell you what they like and to tell you what they don't like, be it food or be it their routine, or that they want to stay up all night watching films and eating popcorn. They should have the ability to do that. They should have the confidence to do that. You can think about that in terms of children, of course you can. So allowing that child to have their own identity, allowing them to speak up and tell you that actually they don't want to play with cars, they want to play with water. They want to point at that water. They're not pointing the car, yeah? It's about you having that relationship where you can recognise the difference in their behaviour. If a person is in control of their care, so if an individual is in control of their care, it is actually less work for care staff, nursery staff, because it might be that they can look after their own personal care. So just because a child has a physical disability doesn't mean that they can't learn to be potty trained. It might take a little bit longer, it might not. They can perhaps learn to use the toilet. That takes away a lot of your responsibility, and it gives them their own privacy and dignity during that time as well. Okay. So when you are writing out 74, you can say the importance of promoting independence for individuals with a physical disability is, and you can tell me some of those points. So I talked about the word value, the word identity, confidence, personal care, independence, dignity, privacy, preferences, choices, let their voice be heard. Okay, so just pause this video here if you're still writing. So your last question says, give examples of ways to promote the inclusion of individuals with a physical disability in society. Okay. So just as a bit of a reminder of what inclusion means, because we can't promote it unless we remember what it means. So inclusion means that all people, regardless of their abilities or disabilities or healthcare needs, have the right to be respected, to be appreciated, to be valued, to be able to participate in their local communities in recreational activities, to be able to work in later life, and to be able to access education from preschool through to college and continuing education. And that is what inclusion should be. So how can we promote inclusion for individuals with a physical disability at the very start of their lives when we're working in preschools and nurseries? So to promote inclusion, you need to educate people, okay? You need to educate people so they understand the differences that people have, which should stop discrimination. We need to adapt the environment around us. So we need to make adjustments to make the environment accessible. It's easy to say about a wheelchair user. You know, if your curb is this high, how is a person with a wheelchair going to get up the curb? That's why many curbs are dipped, but sometimes there's no opportunity to get up a dipped curb. Increased opportunities for employment, okay? So at the moment, it's probably not yes, people take into account physical disabilities, but not many workplaces are accessible fully, okay? People can also be discriminated against for having too many hospital appointments, so their sickness record goes right up, which isn't fair. But hopefully, you know, the children that you end up working with in nurseries, in preschools, in infant schools, hopefully things will change by the time they get to this point. More adapted housing. So again, we're in a housing crisis. Hopefully more of the houses that get built will be accessible, because this allows people to be more independent at any age. If a child can walk from room to room without needing help, be it because they can't see, be it because they can't hear, be it because they can't use their legs, it's much easier for them to be independent. They're going to be less frustrated, and their independence is only going to grow. Getting help from voluntary groups. So I talked a bit before about MenCap, Scope as well. There are lots of different charities out there that can help to promote inclusion, okay? So for your last question there, that's what I want you to do. Pick 4 of those that I've just looked at. So adapting environments, education of society to stop discrimination, employment opportunities that are accessible and not discriminating, more adaptive housing for independence, and getting help from charities such as Scope or MenCap. Okay, so that's the end of this unit, and that's the end of this booklet. So if you have got all of that done, absolutely hats off to you. Honestly, you've done really, really well. Cracking job. We do still have your other booklet to go. I'm going to have to change a few things in that booklet because some of it is practical, and unfortunately we obviously don't have the classroom right now. But I shall let you know about that in due course. Okay, thanks for watching.